Um, I'm excited to welcome you all to our third session of the Lifestyle Medicine series, the Lifestyle Medicine Social Prescribing webinar series. So this is actually a bi-monthly webinar initiative designed to support all of us in primary care with evidence-based practical approaches to incorporating lifestyle medicine into our practice while addressing social aspects of caring for patients. So CCHOHT is kindly supporting these series, which we really appreciate. Um, as we all know, in our practice, we've seen lifestyle and social factors play a big role in chronic disease prevention and management. So this series will aim to explore how the 6 pillars of lifestyle medicine, nutrition, physical activity, sleep, stress management, social connection, and reduction of risky substances can be integrated into our clinical practice to improve patient outcomes. Additionally, our goal is to provide information that will help us navigate social issues impacting patients and their caregivers so as to provide more holistic and proactive care. So today's session will explore how nutrition, physical activity, and targeted supplementation can enhance strength, metabolic health, and vitality, especially in midlife and beyond. With a focus on practical tools and clinical strategies, Dr. Stein will share insights on optimizing muscle health, preventing age-related decline, and supporting longevity through sustainable lifestyle interventions. We're thrilled to have Dr. Stein presenting today. She is a hospitalist at Oakville Trafalgar Memorial Hospital and is also board certified by the American Board of Lifestyle Medicine with advanced training in functional medicine, hormonal health, and longevity. She is a podcast host, international best-selling author, and a founder of Wellness MD, which is Halton's only longevity and lifestyle medicine clinic, as well as Derm Aesthetics, which is a toxin-free medical skincare line. So before we get started, just a few housekeeping points. It would be great if you could all mute yourself so we minimize background noise. And I'd also like to ask that you kindly hold your questions for the end of the webinar. So you could keep putting it in the chat box as we go, or you could ask your questions at the end. And with that, I'll turn it over to Dr. Stein. Thank you all for being here.
Nibby, thank you so much for your very kind introduction. And Sarah, thank you so much for Connected Health Ontario organizing this. I think it's an incredible initiative. Research shows us that when doctors care better for themselves, they tend to be better doctors. And that is my hope today, that you learn something for yourself, not just something that you can give your patients, but that each one of you will learn something today, something that you can implement in your life right away that can significantly improve your health, your quality of life. You can see yourself like a very big boat on the ocean. Or just here at Bronte Harbor, if you implement small changes into your life, you turn the bow of your boat a little bit to the left, in 5 or 10 years, you might end up in Toronto. If you turn your bow a little bit to the right, in 5 or 10 years, you'll end up in Hamilton. And that's my goal for each one of you, to learn something today, something small that you can just implement every day that will make a significant difference in your health, in your quality of life, so that you're a healthy, strong doctor and you can help our community to be healthy and stronger. So let's jump in right away. We're going to talk about longevity today, and we're talking from a lifestyle medicine perspective. I first want to address health span. So initially we talked about lifespan, how long we live, and we know that people now live much longer, but we also have so many of our patients that we know live longer, but they don't live with a good quality of life. People, can live long, but with significant illness. So then we developed a different term called health span. And health span is how long do you live healthy, independent? How do you live longer, but then also stronger, without illness, without morbidity, independent, strong? If you envision the end of your life? How do you want that last 10 years to look like, that last 20 years to look like? You want to most likely be able to play on the beach with your great-grandchildren, being able to sit on the sand, build sandcastles, and then get up independently without aches, without pains, without needing other people to care for you. And that is our goal. Our goal is to live longer and to live stronger and to implement things now in order to be healthier. I have my diploma through the American Board of Lifestyle Medicine, and that is what lifestyle medicine is. It is really a specialty in medicine that is new-ish, but it is part of the reason why all of us went into medicine. That's where we look at the root of illness, and we look at the etiology, and we say, why? Why do we develop diabetes? Why do we develop insulin resistance? What are the things that we can do to prevent illness? Or once we do have illness, what are the things we can do to reverse this illness? Or even if we can't reverse the illness, what are the things that we can do to have a significantly better quality of life? Less morbidity, less mortality. Good news, there is so much research now of things that we can easily implement into our lives and that we can teach our patients to implement into their lives. So with longevity medicine, we really focus on the prevention, the early detection, and then lifestyle interventions to either delay or to avoid chronic illness. So the biggest illnesses that impair quality of life now in Canada would be these four on the screen. The first is cardiovascular disease, cancer, neurodegenerative disease, and metabolic dysfunction. Most of them are very intertwined. As soon as we get cardiovascular disease, say you have insulin resistance and you have chronic inflammation, and then that same cardiovascular disease, the same pathology that causes a heart attack, would also be the pathology that causes peripheral vascular neuropathy, that cause stroke, that cause dementia. Then in cancer, we've seen with research showing that two people can have exactly the same cancer, but through lifestyle interventions, some people can live longer and stronger with a much higher quality of life. Same thing with neurodegenerative disease, which also then includes dementia and metabolic dysfunction, which would also then end up with dementia. We say that this is the next diabetes. People who get insulin resistance at a younger age develop diabetes at a younger age, end-stage renal disease, and then you're at a higher risk of developing dementia. The good news is there is really something that we can do for all of these illnesses to help go back to the root cause and help decrease our own morbidity, mortality, improve our quality of life. So the research, and there are many different research schools of thoughts around it. Lifestyle medicine is one of them. Some people do more training in functional medicine, integrative medicine. Lifestyle medicine is just the path I chose. And for the 2 years that I did my diploma in lifestyle medicine, we really looked at all the research of things that you can do, and we call it the 6 pillars of health. Things one can do to increase health span, longevity, and vigor that you live with. So the first pillar is whole food, plant-based nutrition. This has been an absolute eye-opener for me to look at all the research of how the food, and I'll get to that a little bit more in depth in our next slide, but how what we eat makes a significant impact on our mood, our energy, and then also our longevity. Our next pillar is our physical activity. And that is often something that we can easily implement. If you take something home today, just start by tracking your food maybe, or start tracking your movement and become more aware of what are you actually doing in your own life. Most of us think we move way more than we do. They say in hospital here that sitting is the new smoking. The way that smoking was a big cause of illness 40 years ago, much less people in our population smoke now, which is good. But a lot of people just sit all day, sit in front of the computer, sit in front of the TV. And as soon as you become more aware about the impact of movement on your health, on your bone density, on your muscle strength, that can make a significant impact by increasing movement and these different ways of movement that I'll address later on, that you can start moving your body more. Some studies show that it's actually not just our metabolism that's declining as we get older, causing weight gain, but it is a lack of movement. And if you look at how much your kids move, your kids are constantly moving, running around. If we have the same amount of movement in our lives as our kids have, we would likely be at the same weight as them. But so movement is really key. Next one is stress management. So this is big for every doctor that I've ever worked with. I think a lot of doctors don't realize how much stress they have in their lives. But stress has a significant impact on our quality of life, on the illnesses we develop. And the good news is that we can actually do things to manage our stress. And I'll get back to that later during our talk. Next one that's big is avoidance of toxins. We often see it in our patients that a patient might come to you and they can't lose weight and they can't do this, they can't do that. But then as you dig deeper, you realize that they're doing things to harm themselves. And those toxins can be in different forms. It can be alcohol, it can be sun exposure, it can be unhealthy relationships. But that is really key factor in lifestyle medicine, is to make sure that we avoid toxins in our body. Next absolute pillar of health is restorative sleep. That's usually the first thing I address when I see people for weight loss. And then people would often say, oh, they're not coming to me about sleep, they're coming to me about weight. But if you don't get good quality of sleep at night, then it's not just about the hours, the quantity, it's really about that quality of sleep. If you don't get good quality of sleep, you don't go into your deep sleeps and your body don't restore, that is when we feel more fatigued the next day. That will cause you to not have energy to move your body. That will make you turn more to unhealthy foods, carbohydrate-rich foods or sugar-rich foods for energy to get through your day. And that is quite often treated by improving your quality of sleep. And the next pillar of health is our social connections. That is absolutely mind-blowing, how the biggest predictor of your longevity, your quality of life, is really centered around your social connections. And we, especially as busy physicians, we often put so much into other aspects. And even if you want to live better, you maybe start going to the gym, you start eating more healthy, you stop smoking, you don't use other substances. But we often don't invest in our close relationships. And I'll talk to that towards the end, but that's literally a pillar of health, is your social connections. So next one, to talk about nutrition. So nutrition is key. We often see as physicians, we would maybe skip meals, eat through lunchtime because you've got so much to do. At night, you're running the kids around. So that is often an area that's neglected. What we really need to eat is an anti-inflammatory diet, rich in fruit, rich in vegetables, whole grains, getting all the omega-3 fatty acids in. Then patients often say, I found that when I had only family practice, the most frustrating thing when patients would come in and they say, oh, their hormones are off. I just need to test their hormones. And then I'll say, no, your hormones are not off. And they'll be like, oh, but I'm tired. And then I always felt to just say, yes, I'm tired too, right? But it's not your hormones. And then sometimes when people are really pushing, I would test their hormones and say, see, your hormones are normal. But they'll say, but doctor, I can feel my hormones are off. And then as I was learning more now through my nutrition, that the impact of nutrition on your hormones, it was such an eye-opening experience to me. And I'm like, yes, maybe you are right. Your hormones are off. Maybe it's not the estrogen and progesterone, FSH and LH that I tested for. But yes, so I want to pause here a little bit and to just touch base on why patients say they feel that their hormones are off when their nutrition is actually off. So you need proper nutrition for every metabolic function in your body, but then also specifically for your hormones. Let's start with one of our biggest hormones, insulin. If you eat a diet full of refined carbs, sugars, then your insulin will spike every time. When you have a croissant for breakfast, your insulin spike. When you eat bagels, pizza, pasta, any white carbohydrates, your insulin spike. When your insulin spike quite a bit, you develop insulin resistance. Insulin resistance then causes weight gain, diabetes. It causes fatigue. This is really a precursor for cardiovascular disease, dementia. A way that you can easily counter these sugar spikes is with every meal to add protein to every meal and fiber. That's such an easy fix. As soon as you understand the whole biology behind it. And for yourself in the morning, instead of just grabbing a granola bar for breakfast, if you make sure that you have protein, you can test your own sugar. It's been an eye-opener for myself when I used the Dexcom monitor, and you can buy it over the counter. You don't have to have diabetes. You can just walk into a pharmacy, buy a Dexcom monitor, wear it for a week, and see what influence your food have on your blood sugar. So say you eat in the morning 2 eggs with tomatoes, with mushrooms. You'll notice that your blood sugar won't spike. Your blood pressure, your blood sugar will go up gradually, and it will be sustained for longer. For me personally, that has a big impact on my mood. I don't get irritable or annoyed or fatigued when my blood sugar is well controlled, when I eat well. And you might find the same with you. And for patients, that, might be a very easy fix, rather to look at all the foods to avoid. Because I used to tell patients, as soon as I diagnosed them with diabetes or insulin resistance, they must just stop eating white carbohydrates. They must stop eating sugar. They must stop avoiding all these foods. But I've learned since that it's much harder for patients to avoid a long list of things than if you tell them to just add something. Just add protein to your meals. Just add fiber, healthy fats, especially salads. Before I did more training in nutrition, I kind of felt that it was a little bit of a waste to eat salads. But now I've learned, and the research shows us that if you are going to eat a big meal, but before your meal, you have a salad, a bowl of greens. So in a restaurant, instead of having a bread basket, you can order a salad for the table. If you eat a salad before those, fibers help your body to slow the absorption of sugar, so your sugar doesn't spike, and then the protein keeps your blood sugar stable for longer. It keeps you, increases your satiety. Next hormone that people that is impacted by diet is your cortisol. So every time you're stressed out, your body secretes some cortisol. Things like sugary foods, caffeine increases cortisol spikes. And then interesting, people that are chronically dieting have elevated levels of cortisol as well. So cortisol gets secreted when your sympathetic nervous system is stimulated, when you're stressed out, but also when you're chronically dieting. So that's quite often when people come to you and they say they're overweight, but they don't eat anything. I used to think, is that really possible to be at an unhealthy weight and like you're not eating nothing? I was always like, no, this can't be true. This can't be true. Till I started working more closely with people and we would do a very strict food log with a glucose monitor, see exactly what people eat. And I've been blown away to see how little some people eat. But then interestingly, if you really eat very little food, then it puts your body into a famine mode where you are more stressed, you secrete more cortisol, and then your body holds on to fat stores. And it makes it harder for those people to lose weight. So cortisol is another hormone influenced by your food, another. And then your sex hormones, actually, estrogen, progesterone, and testosterone, all three of them are influenced by food. That is why women who are very skinny or has a low body fat stop menstruating. That is why women with a low body mass index have such a hard time falling pregnant, have a higher incidence of infertility. So fats are really essential building blocks for estrogen, for progesterone. So that is why when someone comes to you for testosterone or hormone replacement, you always have to look first at their nutrition. If people are not getting enough healthy fats, then just giving hormones at the end won't give you such good results as improving healthy fats like avocados, walnuts, all your healthy omega-3 fatty acids, which are the precursors for your sex hormone production. That is more valuable in optimizing your hormones or balancing your hormones than adding exogenous hormones on the outside. Your thyroid is the next one. That is quite a big, zinc, selenium, iodine, all of those, how it affects the thyroid. Then supplements is a big question I get all the time. In hospital, it's quite easy. For all our patients we admit, we do blood work, and I'm just blown away how all our patients are low in magnesium, zinc, vitamin D, vitamin B. And then as we do more research, we find that most of our elderly patients are actually malnourished because most people go on a bit of a tea and toast diet. Then for some people, even if they eat a perfect organic diet, it turns out that our soil in Ontario is quite depleted of a lot of nutrients. We don't have enough magnesium. We don't have enough copper and zinc in our soil. So even if you grow all your own food and you eat a perfect organic diet, a lot of people do have some deficiencies. And that is where it's very helpful for the majority of people, especially elderly people or children or people who want to lose weight, to take a broad spectrum multivitamin. So that if you do have a micro deficiency somewhere, say you're a little bit low in B12 or low in magnesium, your body will realize that you're low in something and it will make you eat more because it needs to eat more to be in homeostasis. And then just taking a general multivitamin, I typically like for women prenatal vitamins because it has a little bit of extra iron. We find a lot of women are iron deficient. So being on a prenatal vitamin, having that bit of folic acid, bit of iron, for most people, that is very helpful. Then there are more supplements that we go case by case. So first, we don't want to supplement an unhealthy diet. We want our patients to eat very balanced, eat veggies, eat fruit. And they found that getting your omega oils from your food is more beneficial than just supplementing. But yes, so then as soon as your patient does have eye symptoms, it is helpful to be on the vitamin A or omega. Or as soon as you see that your patient has sarcopenia, then that creatine supplement protein supplement is helpful. Or if a patient is, especially for people who are just saying they're fatigued, they don't have energy. And it's so tricky for us to just do blood work, because when we do blood work, your body has this incredible ability to stay in homeostasis in your bloodstream. So when we do a blood test, for most people, unless you at the end of the spectrum very malnourished, but for most people, you and me, our bodies, when your magnesium drop, will just take some magnesium from your muscles, so your blood work look normal. Or if your calcium is a little bit low, it will just take calcium from your bones. And then if your protein is low, if you don't have enough protein in your diet, it will, with catabolism, just break down your muscles. So if you just want to quickly test your blood work, for 90% of people, it will look normal. I see the abnormalities because I work in a hospital, but in general practice and for yourself, quite often, our blood work looks very normal until, even if when you start developing osteoporosis, a bone scan can start showing that you have decreased bone density, but your calcium and magnesium might still look normal. Whereas if you were supplementing it always with vitamin D to aid in absorption, you could have prevented becoming osteopenic, if you started that 10, 20 years ago. So that is really helpful. And to give this whole explanation to patients, the specific impact that food has on their quality of life, their mood, their energy, I found in my practice that patients didn't really believe me. So what I found helpful is to just refer them to a nutritionist. And quite often, after they worked with a nutritionist for a couple of months, they see that significant difference in their own body. But yes, so that is when people often ask me, should I be on this supplement, that supplement? If you have a very, very healthy diet, perfectly organic diet, maybe you won't. But many people will find some benefit. Something that's very popular now is creatine. I personally don't use creatine because when I do my body composition analysis, I see that my muscle mass is good. But for the majority of especially females that walk into the clinic that has been chronically malnourished their whole life because they wanted to be skinny their whole life, when we do their body composition analysis, typically they would have a very low muscle mass, and those people benefit incredibly. And that's what all the research is showing us now, how it helps with dementia, with muscle health, with all these benefits. So we always look at nutrition first, and then we supplement on top of that. So nutrition is the big pillar. The next pillar is exercise. That is your most powerful longevity tool. And you have to know your numbers. If you take one thing home today, the research is just mind-blowing how you can predict your longevity by looking at your muscle mass. And that is something that you can change. And even if you tell me, oh, you don't like to go to the gym, you know what? If we don't go to the gym in our 40s and our 50s, then we end up, when you're, God forbid, after you've broken a hip, then you're in hospital. You have to go to rehab to work out in a gym. So I feel it's not really something we can get away from. If we don't work on our muscle mass now in our 40s and our 50s, 60s, when it's easier, we're going to end up needing to work on it in our 80s and 90s when it's much harder. But we still can, we see it every day. When patients, say a patient comes into the Oakville Hospital here with a hip fracture, if they have very, very strong muscles, they get a hip operation, within a couple of days, well, next day, physio will come up, they'll stand up, they'll go home. And you can do it now where you are watching this. If you cannot get up from the floor and stand up without using your hands, then if you have a hip fracture, God forbid, 20 years from now, you also won't be able to get out of bed. And if you cannot get out of bed and go home within that first week after a hip fracture, if we have to keep you in hospital so that to work on your muscle strength, we'll get a dietitian to add protein to your diet, you'll work out with physio, you can build your muscles.
Yeah,
even at
shoulders,
that age.
with range of motion, a lot of history of falls in that area.
But if that is the case, that you have decreased muscle mass, if you have decreased sarcopenia, then your risk of dying that year after a hip fracture is 30%. So that's really mind-blowing how just by increasing your muscle mass, and it's not just once you have a hip fracture, it looks at all the different aspects of life as well. So to go back with muscle mass, know your numbers. Your muscle mass peak really in your 20s and 30s. Then you have about between 3 and 8% of muscle mass loss every decade. And then after menopause, or for men in their 60s onwards, you have 1 to 2% loss of muscle mass every year. That is increased. That's mind-blowing. So if your goal, if you close your eyes and you think, what do you want to look like when you're 90 years old? Do you want to be able to go to Florida on your own? Do you want to be able to play with your great-grandchildren on the floor and stand up? Do you want to live independently? So then you can actually go and calculate, what do you want your muscle mass to be at when you're 90? And then considering you're going to lose 1% every year before that, then you can calculate what it has to be now in your 50s and 60s and 70s. And maybe you need more muscles now to protect you for one day. It's like banking. You know, a lot of people save money for retirement, but maybe we should bank on our muscle mass and our health. So usually in your 80s, you would have lost 30 to 50% of your muscle mass. We call that sarcopenia. And you have significant morbidity that goes in hand with that. So first step I would recommend is for you to just know your numbers. If you have access to a DEXA scan, that's ideal. There are private clinics all over. There's one here in Burlington where you can do a DEXA scan. If you don't have access to a DEXA scan, you can, even if you're at the Oakville Hospital, stop by at our clinic. We don't have a DEXA scan, but we have a body composition machine, an in-body, that shows us how much is fat and how much is muscle. And I find that very helpful because on the outside, you know, there might be two people who look exactly the same way on the outside, but when we do a body composition, we can see how much of your body is muscle and how much is fat. And I find that is also the biggest predictor to determine whether women will gain weight when they go through menopause or not. So if a woman has more muscle and limited fat, less fat, when that person goes through menopause, she will have a faster metabolism than someone who has more fat and less muscle. These are the people who say that they do everything. They exercise, they work out, they eat very low amounts of food. But because her metabolism is slower, they can eat so much less than their twin who has double the amount of muscle mass. So that can make such a big difference into your personal quality of life. This graph shows us how your muscle mass decline with aging. However, with resistance training, we can slow this decline. So with resistance training, there's different components to it. So first thing that I tell most people is you can do it at home. You have to have enough protein in your diet. You can't build muscle if you don't have enough protein in your diet. So start by logging your protein, not forever, just for a few days. And then ideally, you want to get all your protein from your food. I personally have a hard time getting the amount of protein I need. It's 1 gram per kilogram per day through my food, just with the phase of life that I'm in, with having, you know, a busy full-time job and little kids. So what I personally do is to take a protein powder, and there are so many different ones on the market. You can get a vegan, you can get whey. If you don't do good with the one, you can try a different one. And that is what I personally do to make sure in the morning I at least get protein in to help with muscle mass. So with building muscle, first, you must have adequate protein in your diet. Secondly, you have to do resistance training. So when people ask me about weight training, I usually recommend that you start with YouTube, just at home, and you do things like squats. That's the best way. And the way you can imagine it is if you have to stand up from your chair and sit again, you can set your alarm and do that several times a day, just to stand up and sit, stand up and sit. That works your muscles. And then if you get tired from that, that's maybe good enough for the first month. And then once you can do squats, then you can go to lunges. If you can't do push-ups from the floor for upper body training, you can actually start by doing it against the wall. That's what I show to most of my patients, is just to push away from a wall. That's a good place to start. And then as you get stronger, you can start planking, you can start doing other things. So for strength training, you don't have to be intimidated. You don't have to go to a gym. You can literally start it with your own body resistance. So for practical tips, and what I recommend for each one of you watching today, is to highly consider working with a personal trainer. So I know what to do for strength training. I know that I have weights in my house. I have YouTube videos that I can watch for free. But I saw in my own life, if I had to do strength training on my own, I just never did it, ever. And I want my husband to do strength training because I want my husband to live long. I want him to be able to go with me on holidays in Florida when we're 90 years old. But whenever we would set our alarm, because we have to work out like 5 o'clock in the morning before the kids are up, when we set our alarm, then he would say, oh no, let's rather sleep. So what I found helpful in our house was actually to get a personal trainer to come to our house to work out with us in our basement. And even though it feels like a lot of money, if you do that, that investment in your bone density, I honestly believe for me that that's worth more than putting that amount of money towards my RRSP, because that's where I build into my own health, my own strength. So my parents are currently staying with us, so we can't go into our basement anymore to work out in the mornings. So we actually joined a gym where they focus on strength training. And that makes such a big difference, the two of us going together and doing resistance training together. And that's where it's helpful if you work with a personal trainer, because what often happens is patients come to me, I tell them to do weight training, and then they come to me a month later, and now they have a sore elbow or a sore shoulder. And so it's good to start very slow. Don't worry, you won't get bigger muscles unless you work with very heavy weights. But for most women who are concerned about bigger muscles, what's going to happen in the beginning is you're just going to increase your bone density and your muscle mass. And with body composition, you will see you might stay the same weight on the outside, but your body fat percentage will decrease and your muscle mass will increase. Then the next thing that you can do that can make a significant difference in your longevity, in your quality of life, in your energy, is cardiovascular exercise where you increase your VO2 max. So there is so much research that's come out now since we studied med school. You know, we didn't learn these things in med school. I honestly believe we didn't have all the research. But now it shows how it prevents mitochondrial dysfunction, how it prevents dementia, how it prevents cardiovascular disease. People with a higher VO2 max have a longer life and a lower risk of cardiovascular disease. So with every med increase, it literally cuts your mortality by 10 to 25%. So that's absolutely mind-blowing. So what we do when you want to increase your metabolic fitness would be starting by just walking, and then they call it where you walk very fast, and then if your joints are okay, where you would actually run for a minute, and then you can walk again for 5 minutes, and then you run for a minute. So you want to stress your heart and your lungs where you get out of breath and you break out in a sweat. If you don't get out of breath, you are not optimizing your cardiac function. You're not making your heart work harder. You're not making your lungs work harder. This is something that you can do for free. For my patients who are at a heavier weight and tell me that it's too hard on their joints, too hard on their knees, I typically recommend that they get a stationary bike. But you want to do this in a way that you break out in a sweat and that you get out of breath. If you never get out of breath with physical exercise, you're not going to optimize your lung function. You're not going to optimize your cardiac function. And it is quite key. When people ask me what type of exercise they should do, I always start by saying something you enjoy. If you don't enjoy it, you're not going to do it. But then, so doing anything is better than nothing. But then once you have the exercise, say you enjoy going to yoga, Pilates, doing your strength training twice a week, if you want to take your health to the next level, it is very helpful to improve your VO2 max. And you can do that by running on a track. And you start by walking, then you start by walking faster until you get to that point where you can actually run. It will make such a big difference. And you can run for short intervals, 1 minute, and then walk 5 minutes, 1 minute, but to improve your lung capacity and your VO2 max. The next big pillar of health is the ability to relax. So many of us don't have the ability to relax. Some people are blessed with multi-B personality, like my husband. He's very good at relaxing. He can do this very well. This is not something that I was really born with, or something that the way I grew up was nurtured into me. So the combination of having a type A personality and then also growing up in an environment where we have to accomplish things and check boxes. And I know many physicians, all the physicians that I work with who come through my clinic doors cannot relax. Good news, this is something you can learn exactly in the same way that you can learn to ride a horse. You can learn to relax. Research shows us now that chronic stress activates your hypopituitary axis, adrenal axis. It causes elevated cortisol. It increases your risk of autoimmune diseases, of heart disease, of any chronic inflammatory disease. It shows us that it causes telomere shortening, which accelerates cellular aging. It increases chronic inflammation, promotes oxidative stress, mitochondrial dysfunction. Good news is we can counter this. There's a very good book to read, Why Zebras Don't Get Stress Ulcers. You know, I'm from South Africa, when zebras are grazing in a field and a lion come and catch like the weakest one, 5 minutes later, the other zebras are restfully just grazing again as if nothing happened. So as humans, often when something stressful happens, we ruminate over it. We keep replaying it in our brain. So even though the stressful incident was just 1 minute, or 1 hour, or 1 day, we often let that replay in our mind to such a degree that it feels like we're continuously having the stressor. With mindfulness, with meditation, we become aware of what's happening in our mind. And even if you just take one thing home today, if you can set your alarm every day, 12 o'clock, to go off, and then you just take 5 minutes for yourself. You go as if you're going to the washroom, but what you do is you just get a cup with boiling water, and you go and stand in a consulting room, close the door behind you. You just take 5 minutes for yourself, and you just become aware. What are you thinking about? What is filling your mind? That is really the first step of being able to relax. We are often not aware of what is happening. So it's really self-awareness is that first step. So for those 5 minutes that your cup of hot water is cooling down enough for you to drink, to just take deep breaths, center yourself, and just become self-aware of what you're thinking. That's really, really step one. Then if you want to take it to the next level, you can start journaling and expand your vocabulary. Physicians would come into my office and just tell me, oh, I hate my job. Can't wait to retire. And then if we say, but why do you hate it? We often don't know why. But if we put that 5 minutes every day and we think, why are we stressed? Why do we hate? We often realize that it's only 5 or 10% of our day that's stressing us out. that we hate. And then once we know that, rather than saying just it's a bad day, to put a word to that, I felt undermined. I felt disrespected by a patient who trusts ChatGPT more than my wisdom. As soon as we put more words to that, then that can help us to address it and to manage it. But we can't manage things if we don't even know what's happening in our mind. So step one is increase self-awareness. We do that through mindfulness meditation. Even if you've never meditated in your life, I recommend you try it. There's a very good app that I recommend to my patients that are non-religious. I have blogs on my website if you just want to learn how to do it. But an app that I used with my kids and a lot of my patients that's non-religious is called Headspace. It's free for 2 weeks, then you can cancel after. But just to explain what meditation is, it's not necessarily that you have to blank your mind and and ah, but it just helps to slow your thoughts. Next one that's very big is regular exercise. I have a very hard time meditating, so what's helpful for me is when I do run, that regular exercise gives you that deep breathing. When you go for a run, you stimulate your diaphragm, which stimulates your vagus nerve, which stimulates your parasympathetic nervous system, which promotes relaxation. Sleep optimization is big. That is really key to get good quality of sleep. You can use any of these fitness trackers to track your sleep. Cognitive behavioral therapy is really a key about how to improve. And I have on the last slide a resource you can use for yourself to improve your own sleep through cognitive behavioral therapy. It's extremely successful, extremely. Most patients need 6 sessions, especially physicians who go through this workbook themselves. Especially when I see physicians, I always recommend they get this workbook of Amazon. I have it on the last slide to just work through for yourself, and then you can give these skills to your patients easier. But it's usually 6 sessions. It's really a step-by-step guide how to optimize your own sleep so that we go through 90-minute sleep cycles. You go through stages at night where you will be awake. But if you can go into a very calm, restful stage and phase, your body can still get rest. A big pillar is your social support, your community, and I'll talk to that more on the next one. And then, so sleep is critical. That has been a complete game changer for me as I studied functional medicine and then lifestyle medicine, and I read through all the science of sleep. So I grew up in a house where sleep was not regarded as very important, where especially my dad, parents prided themselves that, oh, they don't need sleep, like sleep when you're dead. But we now understand how critical it is for optimal hormone regulation, especially if you have that patient sitting in front of you saying their hormones are off. It could very likely be if they are sleep deprived. For men, their testes secrete hormones 24/7, but for women, it's typically more when you're asleep that your ovaries would secrete estrogen, and that makes a significant difference if you optimize sleep. This is something that you can improve, which is good, without pills, by different strategies, but sleep CBT is one. Big thing is toxin avoidance. So if you are not drinking alcohol and you're not sitting in the sun all day and you're not smoking, good for you. But if you want to take your health to the next level, you can get these different apps. I like Yuka, the one on the screen, just because it's free. And you can start by scanning all your food in the grocery store. And then you'll see which of the foods we eat that maybe have carcinogens in it, foods that are banned in Europe, but that we're still allowed to eat, especially if your kids are struggling with attention deficit. If they are exposed to colorants, things every day that says on this app, don't. Then for women that tell you, oh, their hormones are a little bit off, or if you feel that something is off, you'll see that in a lot of our cosmetic products, they are actually hormone disrupting products. So we call it endocrine disruptors. So it means it's a substance that you have in your Under Armour or your facial cream that gets absorbed, same way that estrogen replacement therapy or testosterone gets absorbed through our skin. Our skin products get absorbed. If there is a substance in it that mimics estrogen and progesterone, it goes and sits on those receptors. And then because it blocks those receptors, your own estrogen can't be stimulating, doing the work that it needs to do on those receptors. So it's helpful for yourself, if just to make sure the products you use at home are clean. Last pillar, most important. And unfortunately, because of time, I'm going to have to run through this. But this might have the biggest impact on your quality of life. There's a study we refer to as the Harvard Happiness Study. It didn't start out as a happiness study. It started out just as a study of adult development, but they've researched so many people over so many years that they've actually found a bigger predictor than your genetics or toxin exposures or your diet for your health is your close personal relationships. You know, that is absolutely mind-blowing. If I look at the amount of time that I spend into getting my kids to sports so they do healthy, so they move their bodies, and putting healthy food on the table, and doing CME all the time to be a better doctor. We invest so much time into so many other things, but the research really shows us that the biggest impact on your longevity, your quality of life, would be the quality of your relationships. You know, when I started this wellness clinic, the first person I actually got was a marriage counselor. Because people will often come to me and say, oh, they need just some testosterone for libido, or they need this, they need that. But as I get to know them, I'm like, oh my goodness, you don't need pills. You have a horrible relationship with your husband or your partner, your loved ones. And that is really something that we can improve. If you put the same amount of time into your relationship with the closest people around you, by going to a counselor, reading books, investing time and energy, doing date nights, investing quality time with your children, sitting with them one-on-one, investing time into your relationship, you can get the same benefit that you get in other aspects of life. Same way that if you go to the gym every day, your body gets stronger, healthier. If you invest time into your loved ones, you're going to reap the fruit of investing time. So that's really critical for your well-being. This incredible study that they've done in Sweden for men, showing that the second biggest predictor of dying from a heart attack was being socially isolated. So in Sweden, people, very interestingly, if you read more about the study, live very isolated. But then for men, a bigger risk factor than high cholesterol, bigger risk factor than genetic risk, bigger risk factor than diabetes, high blood pressure, is being socially isolated. So the biggest risk factor for dying from a heart attack was smoking. Second biggest was socially isolated, and only then diabetes, sedentary lifestyle, the others. There's a very big North American study that they've done for breast cancer, for a nurses study, where they followed these nurses with breast cancer for a long time, and they found that nurses who had a very good, closely knit group of friends had less morbidity and less mortality when they had more friends and were more socially integrated. So that is something that we can improve by investing time in our friendships. Okay, practical tools, things that I found very helpful in my practice is, number one, to grab a prescription pad and to write it for your patient. Quite often patients come and they're just tired, or they can't sleep well. And then instead of just writing a pill or doing something on my EMR, I take a physical prescription pad and I say, you have to go for a walk first thing in the morning, before coffee, before you look at your cell phone, to regulate your nervous system, right? Because as soon as you start getting your emails, things, it stimulates your stress response. So if you write down for your patient, first thing in the morning, go for a walk outside for 20 minutes. that sets your circadian rhythm. That's going to help you sleep better tonight. Make sure that you move your body. That's one of the big things with optimizing sleep, is getting enough movement during the day. You can write down for patients to eat more protein and then make it very specific. You can weigh them, calculate body composition if they've done one, is how much protein they need, but just roughly, it's usually 1 gram of protein per kilogram per day. So say it's 90 grams, then you can say 30 grams with each meal. And then you write that down for your patient. It's going to make such a big difference for your diabetic patients, your patients struggling with obesity or struggling with sarcopenia, for anyone, people with ADHD, mood. Often when people come to me and they say, oh, do you think I might be ADHD? I start with this: move every day. Prioritize protein in your food. Look at really the nutrient quality of your food. Calories are not all equal. And a croissant or a bagel, that amount of calories is not the same as veggies. When we talk about a plant-based whole food diet, that is the type of foods that you would see on a farm. So anything made in a factory, bread, pasta, is processed. Anything that's on a farm, corn, sweet potatoes, veggies, those are whole foods. Screen for muscle health is quite important. And then if you have a patient that sits in front of you that is not eating properly, those are the patients that you say, take a supplement. Even if you were taught in med school, supplements just make your urine more expensive, I'm sure in med school they didn't know what our patients' nutrition would look like, and even our own often, right? Next thing is to cultivate sustainable habits. Even if you do something small, if you implement it, you do it every day, always see yourself as that big, big boat on the ocean. The second book here, Motivational Interviewing, is something that made a significant difference in my practice. As family physicians, we don't have time to do this with our patients, so I often refer my patients to health coaches, and for every 100 patients, maybe only 5 of them will be willing to pay out of pocket, but it makes such a significant difference to those patients if they can reverse their illness, come off their insulin, come off their cholesterol medication, come off their blood pressure medication. It's so rewarding, even if it's only 5% of your practice where people do better. Dr. Gabor Mate has done good work. I'm just kind of explaining to people how their stress, how their unhealthy relationships affect their physical health. If you for yourself want to read up a little bit more on longevity, both these books, Younger for Longer and Outlive, are incredible books of things that you can implement every day to optimize your own health. Obesity Good, the Obesity Code is a great book for diabetics. I've had so many patients who can come off all their diabetic medication with diet. So I never stop the medication. I tell them to change their diet first, but then after they change their diet, HbA1c came down to normal, we can cut back. For physicians, each one of the physicians that I work with, I always recommend this book on self-compassion. As soon as we're kinder to ourselves as physicians, research shows us we become better doctors. Undo It is a very big, incredible book full of research for physicians, explaining how your lifestyle changes can reverse most chronic diseases. And please scan this QR code and let us know any feedback. I'm so grateful for Connecting Ontario and for Dr. Nivi Patel, who's hosting this. Thank you so much, and they would really appreciate your feedback. I would appreciate your feedback. I give these types of talks very often, and I don't want to waste anyone's time. I know how difficult it is as a physician to take a whole hour out of your day. So I want to make sure every time I give a talk that people get value for their money. So please give us any feedback. And thank you, Nivi. I'll give over to you.
Thank you so much, Dr. Stein, for that great review of evidence-based lifestyle strategies that we can all incorporate into our own lives and also to help our patients improve strength and fitness as they age and improve their health span and lifespan. It's particularly important, as you mentioned, with the high risk of sarcopenia, frailty, and falls that we see as people age. So thank you so much for that. There is a question in the chat by Dr. Beverly Chan. And it just says for body composition, how are the home scales that we can get from Amazon, like the Garmin
Yes,
or the other ones? Yeah.
yes, yes. I personally like Garmin. My Garmin is very close to the in-body that I have in the clinic. I think it is helpful. I think it is more helpful to have something at home than nothing. I think it is a good idea to once, if you have access at your gym or somewhere. So the most accurate one is DEXA scan. So if you can get a DEXA scan once, I haven't done a DEXA scan myself yet, but just research shows us that's the best. Then if you can just go to your local gym and you can get an in-body just once, and then compare that in-body to your scale at home, that will give you kind of an idea, how big the discrepancy is. So I know Garmin is a better brand. I can't really speak to any of the others. I do know that when I see patients for weight loss, if they weigh themselves at home and they don't lose weight and they don't lose weight and they don't lose weight, when they do weigh themselves on our in-body, and it shows that even if your outside weight is just dropping 1 or 2 or 3 pounds, but inside your fat mass is decreasing and your muscle mass is increasing, that makes it easier for people specifically on a weight loss journey to see how their muscle mass is increasing. Any other questions? So there's the questions I get all the time from other physicians. So when we read up on longevity, we see a lot of things about hormones. That's very popular in the States. My patients who are physicians often go to the States to get these things. None of them are FDA approved in Canada. So testosterone for muscle mass and what's the others? Oh, all the peptides are not Health Canada approved. And then especially with hormones. So there's a lot of research now showing, estrogen protects against dementia, against heart disease. And then people ask me, what do I think about that? Our current Canadian guidelines are that hormones are only for hot flashes, testosterone for women only for libido. So we cannot give it for longevity. We don't really have longevity really recognized as much in Canada yet. But there is something called the healthy cell hypothesis. So if Nivi or me sees a patient in a hospital who has dementia, who comes in with a heart attack or a stroke, we won't give them estrogen to treat the dementia or the heart attack or the stroke. But if we give it to women in that first 10 years perimenopausal to optimize for menopause symptoms, then they found while they're still having healthy cells, so within the first 10 years of going through menopause and your cells are still healthy, then it maintains your cells to be healthy for longer. So while your heart cells are still healthy, while you don't have dementia, if we then put you on hormone replacement, on estrogen, on progesterone, on testosterone, it does slow the progression towards disease. And that's what they call the healthy cell hypothesis. It keeps you younger for longer, right? And that's maybe like self-explanatory, but yeah, that's how that works.
Amazing. Thank you so much again, Dr. Stein. I don't know if anyone has any last questions. I know we're over time, but thank you all for joining and staying longer.
Thank you. Oh, we are over time. My goodness. My apologies. Thank you so much. Thanks for
It was an
everyone's
excellent
patience and
talk.
grace. Yes, thank you so much.
I also, I just wanted to remind everyone too, just in line with, some of the recommendations made today, we have some local social prescription programs that can help offer an avenue for people to stay physically active while reaping other benefits like social connection and time in nature. So the first one is PARX, the Nature Prescription Program. And with the recent partnership with Conservation Halton, we can sign up as providers on parkprescriptions.ca. I'll just put that link into the chat. And once you're signed up as a provider, you can give your patients a physically, like a written time-based nature prescription that they can take to the Conservation Halton website for their 10 free visit coupon. And then the other program is Walk with the Doc, which is a monthly physician-led walking program encouraging physical activity, social connection, time in nature, and health education as well. So referring patients for this is really simple. Just tell them to go on Walk with the Doc Oakville webpage, which I'll put in the chat as well. And it's updated with all upcoming walks. So yeah, those are free ways for patients to stay active, stay connected, and you know connect with other people in the community, which we know is really important.
Mm. Yeah, that's incredible initiative, Nivi. Thank you for spearheading that.
Well, I thank you
And
all
when is
again
your
for your
next
time.
walk with a dog?
So the next walk is this Saturday, September 20th. And we usually start at 271 Kerr Street in downtown Oakville and walk by the lake. So, yeah, if any patients are interested, any community members, if anyone here is interested to join, everyone's welcome.
Amazing.
Yeah.
Thank you
So
so much.
thank you, Dr. Stein. Thank you everyone for joining, and would love if you could fill out the evaluation, which is in the chat, and Dr. Stein had it on her slides as well. If you want to go back, Daniela, it would help us with ongoing planning for the webinar series. And we are working on CME certification and hoping that the next talk scheduled for November 18th and going forward will all be accredited as well. Okay. Thank you all and have a wonderful day.
Thanks so much.
Bye.